Good evening. Today is February 22nd. Oh, sorry, February 26th, right? Looked at the wrong date. I'd like to call to order the Board of Health meeting for Shrewsbury. Do I hear a motion to call to order?
Motion.
I'll second. We've started. Review and approve the minutes from the January 17th Board of Health meeting.
Motion to
Did you have a chance to review them, Karen?
I did have a chance to motion to approve.
Excellent. I'll second. Roll call, Karen?
I approve.
Dr. Abraham is on the call.
Oh, he is?
Yes.
Thank you. Hello, Dr. Abraham.
Hello.
How are you?
Good, thanks.
I did not realize you were on the call. Did you have a chance to review the minutes?
Yes, I'd actually made the motion, but I think I wasn't audible enough. So yes, I'll say aye.
All right. Do you approve the minutes?
Yes, please.
Great.
Approved.
Approved. So the meeting minutes from January 17th are approved. Next item is to review and discuss coronavirus COVID-19 updates.
Do you want us to start with that? We can start with that. So, hello, everyone. From the vaccination standpoint, we don't have anything to report.
Can you hear what it's saying?
Yes.
I can hear something wrong, man.
I think it's happened to me before. Just sign out and sign back.
Can you guys hear me? Everybody else can hear me?
Dr. Abraham, can you hear okay?
I can.
Can you? Yeah, okay.
I'm having a hard time hearing him.
Yes, it's just a little low on that end.
You want me to log out and log in again?
Just your volume sounds a little low.
Okay. Didn't change anything, so. How's it now?
That's a little better.
Better?
Yeah. Is it coming from the speakers or just the TV?
Is that any better?
That's
Much better.
Okay, great. All right. We'll go ahead.
Okay.
Thank you.
Sorry about that.
So in terms of the health department vaccination update, our COVID vaccines are still allotted for the uninsured. There really hasn't been much interest lately in obtaining a COVID vaccine. And we have a lot that is about to expire in about a month. So, yeah, that's unfortunate. In terms of illnesses, COVID is pretty steady over the months. It's not really going sky high and it's not really low, but it's kind of maintaining. And it matches the wastewater data as well. That's the COVID piece. And really, there isn't much else in terms of, other than respiratory illnesses, the COVID and the flu kind of match each other. They're both usually up at the same time over the last few months and this month as well.
Excellent. And is there any data on RSV?
RSV, no, because we don't
You're not tracking it.
monitor, we don't, yeah, we don't really track it.
Thank you, Amelia. Anything you want to add to that, Dr. Abraham?
Yes, to say, echo what's been said in general, that the COVID, flu, and RSV activity have started to decline. And hopefully with the milder weather, people will be less congregated indoors. I echo Amelia's observation that COVID vaccination uptake has been extremely poor and continues to be so. So that's a shame that we will lose vaccine because it goes unused. And there's been some scuttlebutt leaked into the news that the CDC is contemplating sometime in April or May removing the 5-day isolation requirement for COVID, and to treat it just like we treat flu or any other viral respiratory illness. That's not final yet, and there are mixed reactions to that, but that seems to be fairly certain that that might be the way the CDC opts to go.
Dr. Abraham, question on that, because I
Sure.
saw that as well. Do you think that will just be for the general population, or do you think there will be differences for healthcare workers?
Excellent question. I don't think it's clear yet what that position might be. So I think your guess is as good as mine. So we'll be all waiting to watch that.
And what is the data looking like for hospitalization and death?
Very low.
Very low?
Yes. In fact, as you may have noticed, that the Paxlovid emergency use authorization has ceased, and so it's now subject to insurance coverage. Out-of-pocket costs vary between $1,300 to $1,500 for a course of Paxlovid.
Wow.
Yeah. So anything, I believe as of next week, if there's any supply that was under the EUA, it has to be destroyed.
Wow.
Correct.
Yep. I
Correct.
got that email today. Yeah, that came as a state alert today. Yep.
All right, well, thank you very much. Anything else to add to the coronavirus update?
No, not from our end.
Next up is to review and discuss updates from the Central Mass Regional Public Health Alliance.
Yes, good evening, everyone. This is Solo Dennis. My apology, I'm having challenge with my Google Meet in the city of Worcester. Can everyone hear me?
Yes.
Yep, we can.
Yes, we can.
Thank you so much. My apology again. I will ask my colleague, Ms. Emma, to give an update on the environmental health inspection in the town.
Thank you. So we've done a total of 65 inspections this past month since last meeting, 3 of which included some of our Title V and septic plans. We've been staying on top of our routine food inspections and any complaints that come through on that end, and also we are making progress on our mobile food vendors as well, getting all of the paperwork in order and scheduling those inspections too.
Great. Can you speak a little bit to the emergencies that are listed here? One's for 9 Arnold Road, the other one is Heath Road.
So both of those complaints came to us from the police department on calls that they were called to the property. 10 Heath Road, there was an issue of a kitchen that was removed. It was removed due to a big leak that they had. I was at the property today and everything has been all set. Everything's restored. 9 Arnold Road, there were reports of unsanitary living conditions in the home. I did visit the property with police and fire and did deem that it is uninhabitable and it does not meet the minimum standards for living. So that property was secured and is to remain vacant until it's brought back into code and compliance.
Were people living in the home?
Yes, there was an elderly couple that was living in the home. They've had assistance from the town and multiple departments and agencies for quite some time. So I'm not too sure the disconnect there, but the conditions were, as I mentioned, it was very unsanitary in the home. I haven't had much contact with them since.
What, in that situation, where do they end up going?
So ultimately, homeowners are responsible for their properties. It's not an ideal situation for them to be put in, and it's not an ideal situation for really anybody involved, any departments. So they did seek medical help. I'm not too sure what transpired after that, but that was the last known whereabouts.
Thank you. And then the other one on here that I had a question on is Whole Foods and FBI.
Yes, we did receive a foodborne illness.
Oh, okay. Sorry.
Complaint for
Too many
Whole
crime
Foods.
shows. I'm like, FBI.
So can I ask a question? The animal, are you doing animal inspections?
Animals could range from chickens to rodents or rats.
Beavers.
Beavers as well. We do beavers and rats, not so much chicken, but those beavers and rats would probably be where that one's coming from.
Okay.
Madam Chair, may I ask a question?
Yes.
So any concerns of listeria? There's been some sporadic outbreaks of listeriosis across the country. Any locally that we should be concerned about?
Nothing to my knowledge. Upon a lot of inspections, there is the conversation piece that comes with employee reportings of employee health and sickness, staying on top of that, making sure that they're aware what to report to the health department and the Board of Health. And throughout conversations, there hasn't been any noted employee health issues.
Great, thank you. And to Solo and Amelia, have we seen any spread of measles from Florida to Massachusetts with people maybe returning after winter back to Massachusetts?
We have not, as of yet, through Maven, that is.
Great, thank you.
Is there a recommendation for adults to do an updated vaccine for measles?
It's usually routinely checked, titers are usually routinely checked in pregnancy. And then there are select situations, for example, pre-chemotherapy or pre-transplant, et cetera, where that the vaccine status is updated because it's a live vaccine and cannot be given post-transplant or an advanced immunosuppression. But routinely not, it's a highly immunogenic vaccine. So most of us who've had it in the routine course of events continue to remain positive for titers, but it's measured in pregnancy and measured in children. And unfortunately, in all the events in Florida, these were unvaccinated children.
Okay, thank you. All right. I guess we are ready to move on to reviewing our meeting schedule for March. So I think we were looking at March 20th
Correct, right? March 20th?
Yes, at 5:30.
at 5:30?
Yes.
Great.
Correct.
Do I have a motion to adjourn?
So moved.
Second?
Great. Dr. Abraham?
Aye.
Karen?
Aye.
Myself, aye. The meeting is adjourned.
Thank you.
Great, thank you.
Thank you.